Leader McConnell has spoken to the cost savings that can be found through medical malpractice reform. It's not only about the cost savings, though, but really so much of it is about access to care. In so many parts of rural America, most certainly in my state, we have providers that have said, I will not assume that risk of delivering a baby. We're not able to attract the OBGYNs to come in. And so where do women go? What do women do? I'll tell you, in my state, in some of the more remote areas, a woman who is pregnant comes to town. Basically, they come to Anchorage, the largest city. They come to town 6 to 8 weeks before the due date to wait in a hotel, in a friend's spare bedroom, essentially because they cannot get the care that they need in some of the more isolated parts of not only the state of Alaska, but places throughout the country. So when we're talking about medical malpractice reform, it is so much about the cost, but it really is so much about access as well. Women are paying attention to the legislation that we have before us. They're paying attention to the issue of health care reform, and they should be. They're the ones that in most of the households that are taking the kids to the doctor, they're paying the bills, they're very conscious of what is happening with their costs. And so when they hear that premiums are going to increase, that means that there's less disposable income for that family. When they hear that there's going to be cuts to Medicare, well, look at the populations within the Medicare, Medicaid populations. It's very disproportionate, but about 69% of the Medicaid eligible individuals are women. They're paying attention to what is happening within these programs. When they hear and understand that increased taxes could mean businesses that are laying off people, their concern is, well, disproportionately, you have more women exiting and entering the job market. Are they going to be the first that will go in terms of the layoffs? So there is a great deal of concern about how we put in place meaningful health care reform that won't increase your premiums, that won't increase your taxes, and that won't negatively impact those on Medicare.